For Your Health Matters today, we are at the Research Medical Center Brookside campus with Dr. Ryan Riggs in a room that a lot of women, a lot of couples potentially have been in before when it's time to start talking about having a family. But Dr. Riggs, you're saying, and one of the main things we're talking about today is that some people, especially women, waiting until later in life to start that conversation.
Yeah, absolutely, for a lot of reasons, including pursuing education.
Sure.
More and more couples, more and more women are waiting to start a family.
So one of the things that you're suggesting on a more regular basis now, and you were telling me before we started rolling that was different just a few years ago, it's more common now, and you're suggesting to more of your patients, you might want to consider freezing eggs for women at an earlier age, right?
Yeah, absolutely. A lot of women don't know that they were born with all of the eggs that they're ever going to have, and that the vast majority of those eggs are actually ovulated or essentially used up by the time they're in their 30s.
Yeah.
So as early as ladies can, if they would like to pursue having a family a little bit later in life, I would recommend that they freeze their eggs, which essentially puts their eggs in a time capsule.
Is there a stigma about that? Is it fear? Is it, I mean, because you were saying just a few years ago that was not as common. What's the reaction you get when a woman comes in and you suggest that to them about, hey, have you ever considered having your eggs frozen?
I think really it's just a reaction of surprise. I think most women, for good reason, are focused on their career and their lives, and they're not always thinking about having a family in that moment or pursuing having children. So once they find that out, they're excited to freeze their eggs. And I really don't think in 2019 and 2020 there's much stigma at all associated with freezing eggs. Most women just say, how come nobody hasn't talked about this with me before?
Big question, obviously, for a lot of viewers is going to be cost with that, and obviously it's different for everyone. But you're saying when you're talking about cost benefit, it potentially is going to cost you later in life if you have to try to get pregnant at a time when it's harder to, that it would be freezing your eggs at 26 or 27.
Sure, no question. It absolutely makes sense financially to freeze eggs when the patient, the lady, is younger. The average age we freeze eggs in the United States is about 37. The average age we want to freeze eggs is in the late 20s. So essentially you're going to get more eggs and a better chance for pregnancy in your late 20s than in your late 30s.
Pretty simple process to have your eggs frozen. Is that a lengthy ordeal?
Yeah, it's pretty straightforward. It probably takes about 1 to 2 months total. From the perspective of the patient, that is about a week and a half of stimulation of the ovaries and then an egg retrieval.
The other thing we want to talk to you today is genetic testing when it comes to those embryos, because that's something a lot of people have very strong opinions about already, but it's something you're talking about. You were telling me that the viability of having a healthy child really can be affected a lot by having that testing done.
Yeah, absolutely. So when we genetically test embryos for all 46 chromosomes, we're just making sure just that the embryo has the correct number of chromosomes. And under those circumstances, patients are much more likely to get pregnant. They're much more likely to stay pregnant. And we only need to put one embryo back, which means they have a lower risk of having multiple gestations. In the end, it just all translates into more healthy babies for more healthy couples.
Which is something that anyone who's ever been in this room or any room like this wants in the first place, and whatever they can to have that healthy baby, that's what they're trying to do.
Absolutely.
Excellent. Dr. Riggs, thank you so much for doing that. We hope you learned something from this, especially if you're considering a family. And if you're not considering a family just yet, you might want to think about that freezing egg process earlier than you did before you saw this. For Your Health Matters, I'm Taylor Himness, 41 Action News.